Hello and welcome back to my channel. Today we're diving into an important topic, what it means to have a positive pregnancy test but no baby is found during an ultrasound. This is often due to something known as blighted ovum. In this video, I will explain what it is, why it happens, and how you can handle this emotionally difficult situation. So if you or someone you know is dealing with this, stay tuned. So what exactly is a blighted ovum? A blighted ovum, that term might even sound unfamiliar or it might even be confusing. Essentially, is when a fertilized egg attaches to the uterus but doesn't develop into an embryo. Despite this, the pregnancy sac and the placenta still form, which is why you get a positive pregnancy test. Your body detects the pregnancy hormone, the HCG, but unfortunately, no baby is growing inside the sac. This is also known as an embryonic pregnancy. It's important to note that this condition is one of the most common causes of early pregnancy loss. What causes a blighted ovum? You might be wondering, what is the reason behind this blighted ovum? What have I done? What is wrong with my ovaries? What is wrong with my husband's sperm? What are the spiritual forces behind this? Most of the blighted ovum cases has nothing to do with you. It is a result of chromosomal abnormalities. When the body detects there is a chromosomal abnormality in the fertilized egg, these genetic issues prevent the embryo from developing normally, which leads to this type of early pregnancy loss. So it's important to understand that this is not your fault. This is not a spiritual attack. You are not going crazy. It's a nature's way of preventing an embryo with severe genetic issues from growing further. Let's talk about symptoms. A blighted ovum can be very confusing because you could still feel pregnant. You might still experience all the typical early pregnancy symptoms like the nausea, the vomiting, the breast soreness. Sometimes a woman can even experience light spotting, like as if you're having implantation bleeding. All of these things might still be going on, but the real deal comes with when you go for ultrasound and you are hearing crickets, because the ultrasound will confirm that there is a gestational sac very visible but no embryo is inside. This is usually discovered around 8 weeks of your pregnancy, when the embryo should have been detectable during ultrasound. How is a blighted ovum diagnosed? Your doctor will usually perform an ultrasound after you have tested positive. That is why it's always very, very important to double check all your positive pregnancy tests, whether with your urine, with your blood. Back it up with an ultrasound at the appropriate time, which is usually around 4 weeks, 5 weeks, 6 weeks, 7 weeks. Sometimes some doctors might even delay any procedure until 10 weeks or 12 weeks when they are sure that indeed there is no visible embryo inside the sac. So once it's confirmed that there is no visible embryo, you can discuss your options, which could be either you let it happen naturally, or you can do D&C, which is dilation and curettage, or sometimes medications to help the process. So let's address the emotional side of this journey. It's very, very crucial because sometimes you're grieving not just because of the pregnancy loss, but also you're imagining what the future holds, like what happens with your next pregnancy. It's completely normal for you to feel sad, angry, confused, even irritated, even feeling like you're under attack spiritually. Is completely normal. But during this, it's important for you to reach out for support. First of all, understand what is going on. Have the right understanding of the whole process, okay? Don't take it too personal. Yes, don't take it too personal, okay? Have this hope that the next one, assuming you've not had a baby before, that yes, you're going to have a viable baby. And if anyone around you is dealing with this, you can lend a shoulder for them to cry on, help them go through this process, help them understand that this is not the end of the road. this is not the end of the world per se, and that yes, God is looking out for them too, because there's a supernatural over this whole journey. All right. He wish above all things that you and I prosper and be in good health, even as our soul prospereth. If God can give us His only begotten Son, it's not a baby that He cannot give us. So don't take it too personal. It's equally important you give yourself time to heal and understand that many women still go ahead to have healthy pregnancies.